On the international scene, U.S. health officials have confirmed the first patient infected with the deadly Ebola virus, which has been diagnosed in that country after flying from Liberia to Texas. It has also been confirmed that the patient sought treatment 6 days after arriving in Texas on September the 20th. He was then admitted 2 days later to an isolation room at Texas Health Hospital in Dallas. Our Foreign Affairs correspondent, Amarachi Ubani, reports on the people's perception of the latest happening.
It's the evening rush hour here in Washington, D.C. Many are going home at the end of their shifts. They're either taking buses or they're taking taxis, they're driving in cars or they're walking. Either way, they're either spreading or receiving germs. This is a hand sanitizer. It's become a common staple for us in West Africa. Doctors say using a hand sanitizer prevents the Ebola virus disease from spreading. America's just discovered its first case of the Ebola virus disease in Texas. How are people reacting to that news?
The Center for Disease Control has assured that this is the first case of Ebola diagnosed in the United States and the first case of this strain of Ebola diagnosed outside of Africa. Texas, where the case has been identified, is almost 22 hours from the U.S. capital, Washington, D.C. And the reactions here are mixed on hearing the news.
It's very scary. It's very scary because it can spread all over.
So even I heard like skin contact, I think just education to get people educated about it, I think is the only thing we can do right now.
And one of the most common things you find any Nigerian has in her purse is a hand sanitizer.
Mm-hmm.
You have one.
I do have several in my house. I actually just switched back, so I don't have one with me right now, but I do have them.
For those who are not aware, there's no immediate danger. Local healthcare providers such as pharmacists like these refusing to speak on camera, so they've received no concerns from the CDC concerning its spreading. Not all Americans, though, live in the illusion that this could be an isolated incident. Winston Taylor is a Nigerian who's lived more than 20 years in the United States. He urges more awareness of the disease, especially among the African community in the U.S.
We as an African state, different countries in Africa, they just ignore the idea that it's Ebola. There's, oh, well, we don't have it in our own country, it's just in the West Africa. No, this is African problem. It's not just West Africa, it's not North Africa, it's the African problem.
But he also wants the U.S. government to spend less on the campaigns against ISIS in Iraq and in Syria, and instead direct resources towards helping African countries battling with the disease.
It may be just one case of the Ebola virus disease in the United States, but it's one case that could prove worrisome if people are not aware of the presence of the Ebola virus disease in the country. However, people depend on the government to do something to curb it. Here in Washington, D.C., I am Amarachi Ubani, reporting for Channels Television News.